Welcome to Understand All. I'm your host, Aslekeir Gairleif. Today, we're embarking on a fascinating journey into the world of modafinil, a wakefulness-promoting agent that's been making waves in both medical and non-medical circles. So, grab a notepad, put on your thinking cap, and let's dive in. Picture this. You're burning the midnight oil, desperately trying to stay awake to finish a project or cram for an exam. What if there was a pill that could keep you alert and focused for hours on end? Well, that's not science fiction, it's modafinil. First approved by the FDA in 1998, modafinil was initially designed to treat narcolepsy, a sleep disorder characterized by excessive daytime sleepiness. But here's where it gets interesting. Modafinil doesn't just help people with sleep disorders, it's also been shown to enhance cognitive function in healthy individuals. A study published in the Journal of Clinical Sleep Medicine found that modafinil significantly improved wakefulness in patients with excessive daytime sleepiness. But the benefits don't stop there. Research in neuropsychopharmacology suggests that modafinil can also boost memory, executive function, and attention in people without sleep issues. Now, you might be thinking, wow, this sounds like a wonder drug. And you're not alone. Modafinil has gained popularity as a smart drug or cognitive enhancer, especially among students and professionals in high-pressure fields. In fact, a survey published in the Journal of Substance Use revealed that up to 20% of university students in some regions have used modafinil to improve their academic performance. But is this trend of using prescription medications for non-medical purposes a slippery slope? It's a complex issue with no easy answers. On one hand, the idea of a pill that can give you a mental edge is undeniably appealing. Who wouldn't want to be more productive, focused, and efficient? But on the other hand, there are serious ethical considerations to grapple with. Is it fair for some people to have access to cognitive-enhancing drugs while others don't? Could the widespread use of modafinil and similar substances lead to a new form of inequality, where success is determined by who can afford the best brain-boosting pills? And then there are the potential health risks to consider. While modafinil is generally considered safe for short-term use, its long-term effects are still not fully understood. The Cochrane Database of Systematic Reviews notes that more research is needed to assess the safety of using modafinil over extended periods. Common side effects, according to the Mayo Clinic, include headache, nausea, and nervousness. But there's also the risk of more serious adverse reactions, like severe skin rashes and psychiatric symptoms. It's worth noting that modafinil is classified as a Schedule I-4 controlled substance in the United States, meaning it has a low potential for abuse compared to other stimulants. However, it's not entirely risk-free. A study in drug and alcohol dependence found that while modafinil has a lower addiction potential than drugs like amphetamines, it can still be habit-forming in some individuals. So, where do we go from here? As with many technological advancements, the development of cognitive-enhancing drugs like modafinil presents both exciting possibilities and thorny ethical dilemmas. On the bright side, ongoing research is exploring new potential applications for modafinil and related compounds. The American Journal of Psychiatry has published studies investigating modafinil as an adjunct treatment for conditions like schizophrenia and bipolar disorder. While the results have been mixed, it's clear that there's still much to learn about this fascinating substance. As we move forward, it's crucial that we approach the use of cognitive enhancers like modafinil with caution and nuance. We need to have open, honest conversations about the potential benefits and risks, and work to develop policies that prioritize public health and ethical considerations. At the same time, we shouldn't let fear hold back scientific progress. With responsible research and regulation, drugs like modafinil could one day help millions of people lead more productive, fulfilling lives. But for now, the jury is still out on the long-term safety and efficacy of using modafinil for cognitive enhancement. If you're considering taking this or any other medication for non-medical reasons, it's essential to talk to a healthcare professional first. Remember, just because something is available doesn't always mean it's right for you. And that brings us to the end of our deep dive into the world of modafinil. We've covered a lot of ground today, from the science behind how it works to the social and ethical implications of its use as a cognitive enhancer. My hope is that this episode has given you a more nuanced understanding of this complex and controversial topic. Whether you're a student looking to ace your exams, a professional striving to get ahead, or simply someone curious about the future of medicine, the story of modafinil is one that affects us all. So, what do you think? Is modafinil a miracle drug, a dangerous trend, or something in between? There are no easy answers, but I believe that by having informed, compassionate conversations, we can work towards a future where the benefits of scientific progress are shared equitably and responsibly. Thank you for joining me on this journey of discovery. Until next time, stay curious, stay engaged, and never stop learning. And that's a wrap for today's episode of Understand All. If you enjoyed our exploration of modafinil, be sure to hit that subscribe button and join us for more mind-expanding content. As always, thanks for listening, and remember, the world is full of wonders just waiting to be understood.